Okay, Bonnie, what a great lead-in, and thank you for all that valuable information. And Dolly, I guess you've kind of already been introduced. Dolly tells me that she was the first dental hygienist to set up a PA 161 business like she has. I think that deserves a big applaud. And she's a Kellogg Community College graduate, worked in public health for 11 years, and started her Tooth Time business in 2006. And as I already said, she was the first one in the state to do this, so I know that she's a wealth of information. Dolly. Thank you.
Morning, and of course, I'm not a public speaker by any means, so thank you so much for having me. Today, I am just here basically to share my story of what I do. The first thing I would like to start out with is that I come from public health. I started out in private practice, and I found it always real funny when I would go to an interview. I would find myself asking, do you accept Medicaid? And I would find doctors, oh, of course not. And as soon as I found that out, I didn't want to work there. I found a big passion for serving the underserved. And I stumbled upon a job at Kalamazoo County where that is all that we saw was the uninsured, Medicaid, kids, and I loved it. I spent 11 years there. It was wonderful. In 2003, the benefits for the adults were all cut. So in order for our clinic to survive, we were looking at alternative methods of how can we make money so that we can all keep our jobs, the clinic can stay open. So we operated using the PA 58, I think it was. So I had the pleasure of starting their portable unit, really got my feet wet, was able to get out into the schools, and was doing Tooth Time, but with Kalamazoo County. In 2005, we were starting to get our component back up in Kalamazoo, and just sitting at Cracker Barrel eating dinner, I heard of PA 161. I'm like, yeah, just another government legislation that's going to pass. And I heard, you know, you can go out into the schools, a hygienist all by themselves. And that's when the first flag went up. And I'm like, oh my goodness, that's what I do now for the county. I can do this myself. So right away, as soon as I found the application online, I filled it out, and that's what I do. So I do feel grateful that I did spend those 4 years with the county. I did learn how to bill. I learned what equipment's going to work, what equipment's not going to work, how to network with different schools, the community. And you know, for me, I have just found there are a lot of really great dentists in the community, a lot of really great people, and if you are willing to collaborate, speak to them, everybody does have a heart somewhere, you know, and they do listen. I feel very fortunate. I've had a lot of really good luck. So I'm just going to share with you my story here. So what is tooth time? Oh, there we go. What is tooth time? There we go. Oh, thank you. But Tooth Time, of course, is a nonprofit organization. So at the end of the year, of course, our goal is to break even, which it's not very hard when you're a nonprofit agency. But we strive to provide preventive dental services, and those are the only services as of right now that we do render. My doctor, he and I are in the process of possibly getting some hospital privileges so that we can service some children that need full mouth reconstruction and older adult special needs that cannot get in for care. So that's kind of in the works, but it's out there. And then, of course, our other goal is to find a dental home. And like I said, it seems a bit overwhelming, but you know, there are areas you just have to be willing to look for them and network. Our targeted population, just like you've already heard this morning, is all the underserved population. So Medicaid recipients, children that receive My Child, uninsured and underinsured. You will find a lot of working class folks that even though they might have some dental benefits, they're unreachable dental benefits, $500 deductible, da-da-da. For somebody that's working, getting minimum wage, you might as well just not have insurance. It's really sad. And then, of course, our services that we offer, oral cancer screening, which is very important, oral screenings, prophies, full mouth debridement, x-rays. We don't do a whole lot of x-rays. I really try hard, and that is one of the selling points for Tooth Time, is that my people that I refer to, they know that when my patients show up, if they bill out for x-rays and an exam, that has not been taken away. My dentist that I contract with is more than willing to come down from his office and do my exams and for us to take x-rays, but I don't let him do that because I want my facilities that my patients are going to be able to recoup on their examination, that they can take x-rays so that they can generate some income for that, the appointment time that the children are there, or the people. We do dental sealants, fluoride varnish. Even for just a routine prophy, I only use a fluoride varnish. It's much more effective for the children, so fluoride varnish. And I also participate with a fluoride varnish program for the early Head Start and the Head Start. And then, of course, oral hygiene instruction. And then the sites that we go to schools, public schools, charter schools, academies, Head Start classrooms, community centers, and churches. And I have the church on there because in Coldwater, there is a church that's called the First Presbyterian Church. I'm not sure if Grand Rapids does it, but I know in Kalamazoo they have a First Pres also, and it's a free medicine clinic, but the church in Coldwater happens to have a grant through, it's either through Blue Cross and Blue Shield or Delta, and they're able to offer some dental services. And I'm very fortunate in Coldwater. I have a dentist that sees all the patients that I see. The church is able to give each patient a $100 voucher towards their continued care, and they can use that for an exam, x-rays, extraction, and then the doctor will also set up a payment plan for the patients. And the people that I see there, my goal and my passion is to work with children, and of course, after 11 years in public health working on many adults, that's why I kind of lean towards the children. But after going to the church, and I kind of drag my feet at the beginning of the month. Oh, I have to go work, because when I work on adults, I have to work. It's for me personally, it's like, okay, I'm working. When I work with children, even though it might be hard for some, I play all day. I come home, I'm dead tired, but it was fun. I played all day long. With the adults, I have to be in a mindset, but I come home at the end of working at the church. Of course, they've strummed on every heartstring I have, and I'm going to go back next month. I love this so much. So they all have me wrapped around their fingers. So I'll keep going as long as I'm able to go. And then funding. Currently, the only grant that I have is with the state of Michigan with the fluoride varnish grant. Not being a 501(c), it's very hard to get grants. So it is, it's not the easiest, but I don't know, as long as I'm able to do what I'm doing, I'm just going to keep plugging away, and somehow magically the numbers just all work out. Even, my personal finances and the business, it just all magically works out, and as long as that happens, I'm going to keep going. So direct billing to insurance companies, and that would be my child and Medicaid, and then the direct billing to the uninsured and the fluoride varnish grant. And then this would be my contact information. And if you guys have any questions, you can call me at any time. I have many, many people calling me all across the state. And I'm willing to help out, share forms, whatever. Thank you.